My name's Tim Black from the University of Victoria and also talking to you today as National Clinical Advisor for Wounded Warriors Canada. We're going to be putting together a series of videos for all the people who've loaded onto our programs who've had to have those programs cancelled as we've been following the guidelines of the Canadian government and the local and provincial governments to reduce the spread of the virus by getting rid of group gatherings. As you know, most of our clinical programs, we do them in groups, and it's one of the best things about our programs is having the group come together and to combat that isolation that comes with trauma and dealing with those things as family members, partners, and as the trauma-exposed members, whether a veteran or public safety personnel, first responders, or their families. The series of videos that we're going to be putting together is going to be covering some of the basics that we are going to be looking at in the programs once we get back up and running. But before we get into that, just want to say a big thank you to all of the supporters of Wounded Warriors Canada, all of the support that's come from the general public, the organizations that have partnered with us, with Wounded Warriors to deliver the programs. This really is one of those things where we realize none of this could be happening without all of us working together. And certainly the programming that we've been delivering over the last 5 years, especially, could not have happened without the support of all the partners and the donors and the people working hard across the country to help fund these programs. So just a big and very sincere thank you to all of you. So what we're looking at right now is how we can start to adapt our programming. Part of this adaptation is looking at the use of technology to try and help us do things, maybe not exactly the way we would have done them in the past, but at least try to do something. These videos and the next few videos that we're going to be posting are the beginning of that. What are we going to cover? We're going to cover the 3 pillars of trauma that we talk about in many of our programs. The BETTER model, body, emotions, thoughts, and relationships. The trauma formula and how people get traumatized. And then the FORGE method to help you manage some of the symptoms and just help yourself get out of those tough spots when the past creeps into the present. As we get into those 3 pillars of trauma, we'll also talk about resource kits. We'll try to prepare you, if we can, in some ways, to start doing the hard work of dealing with trauma, even if you're at home, especially when you're at home, because trauma work requires that we practice things, that we get our skills up and ready. And if we can get things going by introducing just a few of the basics and connecting and just reaching out and connecting through these videos, just a few of the basics. What we hope is that it'll prepare you even better for coming on program once we're back up and running and once we as a country and just as a world get through this. So please stay tuned. Try to keep yourself focused on what's most important, which is your health, your family's health, and the health of those who you love and those around us. Please do follow the guidelines that the government's setting out, as we all are. The University of Victoria is following them, Wounded Warriors Canada is following them. And once again, just a big thank you to all of the supporters from Wounded Warriors across the country who have given us the ability to do the programming that we have and who are giving us the inspiration to keep doing things and adapt our programming. Take care of yourselves, take care of each other, and we will get through this. As the hashtag says, in this together, let's all do our part and stay tuned for the next video.